Here's a shocking statistic that will change how you think about men's health forever. By age 60, over 50% of men will experience prostate problems. By age 85, that number jumps to 90%. But here's what's even more shocking. Most of these issues could be prevented or significantly reduced with knowledge that's been hiding in medical journals for decades, yet somehow never makes it to the men who need it most. What if I told you that something as simple and natural as regular sexual activity, including masturbation, could be one of your most powerful weapons against prostate cancer, enlarged prostate, and a dozen other health issues that rob millions of men of their sleep, energy, and confidence every single year? And what if I told you that everything you think you know about this topic is probably wrong? Today, we're going to shatter myths, reveal scientific truths, and give you a complete blueprint for protecting one of your most important organs. Whether you're 35 or 75, whether you're watching this for yourself or someone you care about, the next 30 minutes could literally save your life. But fair warning, some of what you're about to learn will surprise you. Some might make you uncomfortable, and all of it will challenge what society has taught you about men's health and sexuality. Are you ready for the truth? 1. The hidden crisis. Let's start with something that might shock you. Right now, as you're watching this video, millions of men are suffering in silence. They're waking up multiple times each night to use the bathroom. They're avoiding long car trips because they can't trust their bladder. They're experiencing pain, discomfort, and embarrassment, and they think it's just part of getting older. But here's the truth. It doesn't have to be. The modern epidemic. Prostate problems have reached epidemic proportions, but not for the reasons you think. It's not just about age, it's about lifestyle, stress, misinformation, and a healthcare system that often waits until problems become severe before taking action. Consider these eye-opening facts. Prostate cancer is the second most common cancer in men worldwide. Benign prostatic hyperplasia, or BPH, affects 14% of men in their 40s, but jumps to over 40% by age 60. Most men don't even know where their prostate is, let alone how to keep it healthy. The silent suffering. The real tragedy isn't just the numbers, it's the silence. Men are taught to tough it out, to not discuss these issues, to pretend everything is fine while their quality of life deteriorates day by day. This silence is literally killing us. When men don't understand their bodies, don't know the warning signs, and don't take preventative action, small problems become big problems, and big problems become life-threatening emergencies. The good news. But here's the incredible news. Your prostate is not your enemy. It's not a ticking bomb waiting to ruin your life. With the right knowledge and simple, natural habits, you can keep your prostate healthy for decades to come. You can maintain your energy, your confidence, and your independence well into your golden years. 2. Understanding your prostate. The owner's manual you never got. What exactly is your prostate? Imagine a walnut-sized gland sitting just below your bladder, wrapping around your urethra like a protective sleeve. That's your prostate. It's small, only about 20 grams in a healthy young man, but it plays a massive role in your overall health and well-being. The prostate's critical functions. Your prostate isn't just sitting there doing nothing. It's working 24/7 to produce prostatic fluid. This makes up about 30% of your semen and contains enzymes, proteins, and minerals that keep sperm healthy and mobile. Act as a valve system. It helps control urine flow and prevents urine from mixing with semen during ejaculation. Support hormonal balance. It responds to testosterone and helps regulate various hormonal processes. Maintain reproductive health. It's essential for fertility and sexual function. The aging challenge. Here's where things get complicated. Unlike most organs that stay roughly the same size throughout life, your prostate keeps growing. It starts out grape size at birth, reaches walnut size by 20, and then continues growing slowly but steadily for the rest of your life. This growth isn't necessarily a problem, it's natural. The problem comes when this growth becomes excessive, irregular, or when the prostate becomes inflamed or diseased. The 3 main prostate conditions. Understanding these 3 conditions is crucial for every man. Benign prostatic hyperplasia, or BPH, non-cancerous enlargement that can cause urinary problems. Prostatitis, inflammation of the prostate, often causing pain and urinary issues. Prostate cancer,
the serious one that everyone fears, but is often slow-growing and treatable when caught early. The location matters. Your prostate's location is both its strength and its weakness. Positioned around the urethra, it can easily affect urination as it grows. Close to the rectum, it can be examined during medical checkups. Connected to the bladder and reproductive system, problems here can affect multiple aspects of your health.
The breakthrough research. In 2016, a study published in European Urology completely changed how we think about prostate health. Researchers followed 31,925 men for 18 years, one of the largest and longest studies of its kind ever conducted. The results were stunning. Men who ejaculated 21 or more times per month had a 20% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. But this wasn't just one study. Multiple research projects over the past 2 decades have shown similar results, creating a body of evidence that's impossible to ignore. How does this actually work? The mechanism behind this protective effect is fascinating and involves several biological processes. 1. The flushing effect. Think of your prostate like a filter in your car's engine. Over time, potentially harmful substances can build up. Old cellular material, toxins, inflammatory compounds. Regular ejaculation literally flushes these substances out, keeping the prostate clean and healthy. 2. Pressure relief. When prostatic fluid builds up without regular release, it creates pressure within the gland. This pressure can lead to inflammation, discomfort, and potentially cellular damage. Regular ejaculation relieves this pressure naturally. 3. Hormonal regulation. Ejaculation affects hormone levels, particularly testosterone and dihydrotestosterone, DHT. Some research suggests that regular ejaculation helps maintain a healthier balance of these hormones, reducing the risk of excessive prostate growth. 4. Improved circulation. Sexual activity and ejaculation increase blood flow to the pelvic region. Better circulation means more oxygen and nutrients reaching prostate cells and better removal of waste products. 5. Stress reduction. Sexual release triggers the release of endorphins and reduces cortisol levels. Since chronic stress is linked to inflammation and various health problems, this stress-relieving effect may contribute to prostate health. The inflammation connection. One of the most important findings in recent prostate research is the role of chronic inflammation. Low-level, ongoing inflammation appears to be a major factor in both BPH and prostate cancer development. Regular ejaculation appears to reduce inflammatory markers in the prostate. It's like giving your prostate a regular anti-inflammatory treatment, naturally and safely. Addressing the obvious questions. But wait, you might be thinking, are you seriously telling me that masturbation is medicine? The answer is more nuanced than that. We're talking about natural sexual function, whether through partnered sex, masturbation, or nocturnal emissions. The key isn't the method, it's the regular, healthy expression of normal sexual function. 4. Destroying dangerous myths. The myth-making machine. For generations, myths about masturbation and sexuality have been passed down like gospel truth. These myths aren't just embarrassing, they're dangerous. They prevent men from understanding their bodies and making healthy choices. Let's demolish the most harmful myths once and for all. Myth 1. Masturbation causes prostate cancer. This is not only false, the opposite appears to be true. As we've seen, research consistently shows that regular ejaculation may actually reduce prostate cancer risk. This myth has prevented countless men from engaging in healthy, natural behavior. Myth 2. You can use up your sexual energy. This ancient belief suggests that men have a finite amount of sexual energy that gets depleted with use. There's absolutely no scientific basis for this. Your body continuously produces sperm and seminal fluid. Sexual activity doesn't drain your life force. It exercises important biological systems. Myth 3. Older men should avoid sexual activity.
Society often treats sexuality as something that should disappear with age. This is not only wrong, but harmful. Sexual health remains important throughout life, and regular sexual activity can contribute to overall physical and mental health in older adults. Myth 4. Real men don't masturbate. This toxic myth suggests that masturbation is somehow inferior or shameful. In reality, masturbation is a normal part of human sexuality across all ages and relationship statuses. It's a safe way to maintain sexual health and explore your body. Myth 5. Frequent ejaculation weakens you. Some believe that ejaculation weakens a body or reduces masculine energy. Scientific evidence shows the opposite. Regular sexual activity can improve sleep, reduce stress, boost immune function, and enhance overall well-being. The real dangers of myth believing. These myths don't just create shame and confusion, they have real health consequences. Men avoid natural, healthy behaviors. They delay seeking medical help due to embarrassment. They make decisions based on fear rather than facts. They miss opportunities for prevention and early intervention. Cultural and religious considerations. It's important to acknowledge that cultural and religious beliefs around sexuality vary widely. The goal isn't to dismiss these beliefs, but to separate health facts from cultural opinions. You can honor your values while still understanding the science of your body.
The Goldilocks principle, finding your healthy balance. Not too little, not too much, but just right. The research shows that regular ejaculation can be beneficial for prostate health, but that doesn't mean more is always better. Like most aspects of health, balance is key. What does regular actually mean? Based on current research and clinical experience, most urologists and sexual health experts suggest that ejaculating 2 to 4 times per week appears to offer the best balance of benefits without potential drawbacks. This translates to roughly 8 to 16 times per month, well within the range shown to be protective in research studies. However, it's crucial to understand that there's significant individual variation. What's right for a 25-year-old might be different from what's right for a 65-year-old. Your overall health, medications, relationship status, and personal preferences all matter. Signs you might be overdoing it. While there's no magic number that's too much for everyone, certain signs suggest you might want to dial back. Physical exhaustion or weakness after sexual activity. Genital soreness or irritation. Difficulty concentrating on work or relationships. Compulsive behavior that interferes with daily life. Anxiety or guilt around sexual activity. Relationship problems related to sexual behavior. Signs you might be underdoing it. On the flip side, very infrequent ejaculation might not provide the protective benefits we've discussed. Going weeks or months without any form of sexual release. Experiencing pelvic pressure or discomfort. Having frequent nocturnal emissions or wet dreams as your body tries to regulate itself. Feeling unusually tense or irritable. The quality versus quantity question. It's not just about frequency, the quality of your sexual experiences matters too. Rushed, mechanical, or anxiety-filled sexual activity may not provide the same benefits as relaxed, mindful experiences. Consider these factors. Taking time to relax and enjoy the experience. Focusing on physical sensations rather than external distractions. Maintaining good hygiene and self-care. Being present and mindful during sexual activity. Age-specific considerations. Men in their 20s and 30s. High libido is normal. Focus on developing healthy habits and understanding your body. Men in their 40s and 50s. This is when prostate issues often begin. Consistency becomes more important than frequency. Men 60 plus. Sexual function may change, but sexual health remains important. Adapt expectations while maintaining regular activity. Chapter 6. Warning signs every man must know. The early warning system.
Your body is constantly communicating with you, sending signals about what's working and what isn't. When it comes to prostate health, certain symptoms should never be ignored. Recognizing these early can mean the difference between simple treatment and serious complications. Urinary symptoms, the first red flags. Since your prostate surrounds your urethra, urinary changes are often the first sign of problems. Immediate action required. Blood in urine or semen. Complete inability to urinate. Severe pain in the pelvic area. Fever combined with urinary symptoms. Schedule a doctor's visit soon. Frequent nighttime urination, more than twice per night. Difficulty starting urination. Weak or interrupted urine stream. Feeling like your bladder never completely empties. Sudden, urgent need to urinate. Pain or burning during urination. Sexual and pelvic symptoms. Changes in sexual function can also signal prostate problems. Pain during ejaculation. Significant changes in semen volume or consistency. Persistent pelvic or lower back pain. Pain in the area between scrotum and anus, perineum. New erectile dysfunction, especially if accompanied by other symptoms. The "it's probably nothing" trap. Men are notorious for dismissing symptoms or hoping they'll go away on their own. This is particularly dangerous with prostate issues because early treatment is more effective when caught early. Symptoms often worsen gradually. You may adapt to declining function without realizing it. Some conditions can become serious. What starts as mild BPH can lead to kidney damage untreated. Age-specific screening guidelines. Ages 40 to 49. Establish baseline PSA if you have risk factors, family history, or African American heritage. Ages 50 to 69. Annual PSA testing and digital rectal exams, but discuss with your doctor. Ages 70 plus. Individualized screening based on overall health and life expectancy. Risk factors you can't control. Age, risk increases significantly after 50. Race, African American men have higher risk. Family history of prostate cancer. Genetic factors. Risk factors you can control. Diet and nutrition. Exercise and physical activity. Body weight. Stress levels. Sexual health habits.
The Prostate Protection Protocol, your daily action plan. 2200 to 2700. The foundation, nutrition that heals. Your prostate is particularly sensitive to what you eat. Certain foods can reduce inflammation, support healthy cell function, and even help prevent cancer. Prostate superfoods. Tomatoes and lycopene. Cooked tomatoes, tomato sauce, and tomato paste are rich in lycopene, a powerful antioxidant. Studies show men who eat 10 plus servings of tomato products per week have significantly lower prostate cancer risk. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, and cabbage contain compounds that help your body eliminate toxins and may reduce cancer risk. Fatty fish. Salmon, mackerel, and sardines provide omega-3 fatty acids that reduce inflammation throughout the body. Nuts and seeds. Pumpkin seeds are especially beneficial, providing zinc and healthy fats that support prostate function. Green tea contains polyphenols that have anti-inflammatory and potentially anti-cancer properties. Foods to limit. Excessive red meat, especially processed meats, high-fat dairy products, refined sugars and processed foods, excess alcohol. Movement medicine, exercise for prostate health. Physical activity is one of your most powerful tools for prostate protection. Cardiovascular exercise, 150 minutes of moderate aerobic activity weekly or 30 minutes 5 days, improves circulation and reduces inflammation. Pelvic floor exercises, Kegels. These strengthen the muscles that support bladder and bowel function. Identify the right muscles by stopping urination midstream. Contract these muscles for 3 seconds, then relax for 3 seconds. Work up to 3 sets of 10 repetitions daily. Strength training. Building muscle mass helps maintain healthy hormone levels and overall vitality. Flexibility and yoga. Reduce tension in the pelvic area and improve circulation. The hydration balance. Proper hydration is crucial. but timing matters. Aim for 8 glasses of water daily. Front load your hydration, more in the morning and afternoon. Reduce fluid intake 2 to 3 hours before bedtime. Limit caffeine and alcohol, especially in the evening. Stress management, the hidden factor. Chronic stress elevates cortisol levels, which can worsen inflammation and negatively impact prostate health. Daily stress busters. 10 minutes of deep breathing or meditation. Regular nature walks. Journaling or expressive writing. Social connections and meaningful relationships. Hobbies and creative activities. Sleep, your nightly healing time. Quality sleep is when your body repairs and regenerates. Aim for 7 to 9 hours nightly. Create a cool, dark sleeping environment. Avoid screens 1 hour before bed. Consider magnesium-rich foods if you have trouble sleeping. The sexual health component. Based on the research we've discussed, maintain regular sexual activity 2 to 4 times weekly. Focus on quality and mindfulness. Communicate openly with partners about changes or concerns. Don't let embarrassment prevent you from staying active. Supplement considerations. While food sources are preferred, certain supplements may offer additional support. Evidence-based options. Saw palmetto for BPH symptoms. Lycopene supplements if you don't eat enough tomatoes. Omega-3 fish oil. Vitamin D, especially if you have limited sun exposure. Always consult with healthcare providers before starting new supplements, especially if you take medications. Chapter 8. Special Situations and Advanced Strategies, 2700 to 2930. For men already experiencing symptoms. If you're already dealing with prostate issues, don't despair. Many symptoms can be improved with the right approach. Managing BPH naturally. Double down on anti-inflammatory foods. Consider timed voiding, which is urinating on a schedule. Practice pelvic floor exercises consistently. Avoid medications that can worsen symptoms like certain antihistamines. Working with healthcare providers. Building a good relationship with your healthcare team is crucial. Be honest about all symptoms, even embarrassing ones. Ask about PSA trends, not just single values. Discuss the risks and benefits of different treatment options. Don't be afraid to seek second opinions for major decisions. For men with partners, prostate health affects relationships, and relationships affect prostate health. Communicate openly about changes in sexual function. Include partners in health discussions when appropriate. Remember that intimacy isn't just about sexual performance. Consider couples counseling if health issues are affecting your relationship. The prevention mindset. The best time to start protecting your prostate was 20 years ago. The second best time is today. Start where you are. Pick one dietary change and one exercise habit to implement. Build consistency before adding new habits. Focus on progress, not perfection. Celebrate small victories. Long-term thinking. Your habits today determine your health in 10 to 20 years. Small, consistent actions compound over time. Prevention is always easier than treatment. Your future self will thank you for starting now. Conclusion, your new beginning. The power of knowledge. You now know more about prostate health than 95% of men. You understand the science, you've seen through the myths, and you have a practical plan for protection. But knowledge without action is worthless. Your next steps. This week, choose one dietary change and one exercise habit to implement. This month, schedule a checkup with your healthcare provider if you haven't had one recently. This year, build a comprehensive prostate protection lifestyle. The ripple effect. By taking care of your prostate health, you're not just helping yourself, you're setting an example for other men in your life, your sons, friends, and colleagues. You're breaking the cycle of silence and shame that has kept men suffering unnecessarily for generations. Remember this, your prostate is not your enemy. It's an important part of your body that with proper care
can serve you well for decades to come. The choices you make today, what you eat, how you move, how you manage stress, and how you approach your sexual health all contribute to your long-term well-being. You have the power to take control of your prostate health. The science is clear, the tools are available, and the time is now. Your health is your wealth. Your body is your home. Take care of both, and they'll take care of you. Stay strong, stay informed, and never stop investing in the most important person in your life, you.